Hi, my name is Karen Harrison. I'm a student at the University of South Alabama College of Nursing, and today I will be performing my medication administration checkoff. Here's my badge. Now we will scan the room. The first thing we're going to do is follow the no interruption policy zone. The no interruption zone policy, which states that you will limit conversation with colleagues, accept no phone calls, and keep the door to the medication administration room closed. The next thing you want to do is compare the mark to the patient care order form. Starting with your rights. Right patient, Jaguar J. Jones, Jaguar J. Jones. Right drug or medication, Novolent RU100, Novolent RU100. Right dose, 10 units, 10 units. Right route, subcutaneously, subcutaneously. Right time, 30 minutes before meals, 30 minutes before meals. We will also assess for allergies. On his MAR, he has an allergy for penicillin. And on his patient care order form, he also has an allergy to penicillin. After we do this, we would perform hand hygiene. After performing hand hygiene, we would then select our medication, Novolent RU100. After that, we would then check the expiration date on it, which is 12/1/2025, which means this drug is within date. Afterwards, we would then compare our medical vial to our MAR. Novolent RU100, Novolent RU100. 10 units, 10 units, subcutaneously, subcutaneously, 30 minutes before meals, 30 minutes before meals. Right patient, Jaguar J. Jones, Jaguar J. Jones. Medical record number, 417-6352, 417-6352. And again, he has an allergy to penicillin on his MAR. He has an allergy to penicillin on his patient care order form. After doing so, we will now begin with our another right time. Time, they want it 30 minutes before meals, 30 minutes before meals. Right route, subcutaneously, subcutaneously on his MAR, subcutaneously on his patient care order form. And since we're giving this subcutaneously and the drug is insulin, we would be using an insulin syringe. And maintaining sterility, we will begin to remove the syringe. After removing the syringe, we will now clean the top of our vial with our first, we could start with our calculations in drawing up our drug. Calculations for right dose, they want 10 units of insulin. On his patient care order form, they also want 10 units of insulin. So then we would begin to clean the top of the vial with an alcohol prep pad. Now we will begin to drop our medication. So first we would have to pull back air. Remove the cap. Grab your drug. Stick it through the top. Push the air in. Push the air in and remove the fluid. We'll use the scooping method to scoop our cap and place our cap back on our syringe. Now we will assess for air bubbles, making sure there are no air bubbles in our syringe before giving this to our patient. We then have 10 units of insulin. After that, we would then we would have to get another nurse to confirm and check our dosage and our calculations. After that, we would compare our vial in our syringe to our mark for a second check for accuracy. Novolin RU100, Novolin RU100. They want right dose is 10 units. Right dose, we have 10 units in our syringe. Right route, subcutaneously. Right time, 30 minutes before meals. And also right patient, Jaguar J. Jones. After this, we will begin to prepare a label for our syringe. With the patient name, the drug name, and the dose. And I will also throw my initials on the bottom because I am the nurse. You put this on the back of the syringe, being sure not to cover any numbers. After this, we will now take our MAR, our medical vial, and our syringe to the patient's room. Upon entering the patient's room, we will perform hand hygiene. After performing hand hygiene, we would identify the patient using two identifiers, comparing it to the armband. So, according to our MAR, we have the first identifier, Jaguar J. Jones, Jaguar J. Jones. Our second identifier will be the medical record number, 417-6352, medical record number, 417-6352. He also has an armband for allergy, which means he has allergy for penicillin. So he has an allergy for penicillin on his armband. Compared to his MAR, he also has an allergy for penicillin. After assessing for his allergies and identifiers, we will ask the patient if they have any additional allergies that we need to know about, and we will perform any necessary pre-assessments, such as taking blood pressure and pulse. After that, we will do our third and final check for accuracy, comparing our medical vial, our prep syringe with the label, and comparing that to the MAR. So again, Novolin RU100, Novolin RU100, Novolin RU100. Novolin is the right medication. Novolin, Novolin, Novolin. Right patient, Jaguar J. Jones, Jaguar J. Jones. Right dose, 10 units. We have 10 units of drug in this syringe. Right route, subcutaneously. Right time, 30 minutes before meals. After our third and final check for accuracy, we will now explain the procedure to the patient, and we will raise the bed to a working level and lower the side rails. After doing so, we would don our goggles and our gloves. After doing so, we will now get our injection pad, and we will select an injection site. So for this injection site, I am selecting the abdomen injection site, which means you have to stay 2 inches around the umbilicus, below the pubic region, above the pubic region, below the costal margin, in between the anterior superior iliac spine. After selecting an appropriate injection site, we will now assess the skin for integrity, making sure there aren't any cuts or bruises, and making sure this injection site is the good injection site to give the drug. After doing so, we will now clean our injection site with an alcohol pad, moving in circular motions. After doing so, we will now prepare to administer our drug. So we will grab it, remove the top, pinch your skin, insert the needle at a 90-degree angle. Given that it is a subcutaneous, you can insert it at a 45-degree angle or 90-degree angle. So we're going at 90. Aspirate for blood if indicated. Insert the drug. Remove it, and you will immediately put your syringe in a sharps container bin. After doing so, you will take an alcohol pad and you will apply pressure, noting not to massage the injection site after giving the drug or administering the drug. After that, you will now remove your goggles and you will remove your gloves. And you will be sure to assess the patient for any allergic reactions. You would dispose of any sharp objects. You would raise the bed. You will lower the bed and raise the side rails. You would assess the patient to make sure they're comfortable. You would readjust their gowns and their covers to make sure they're in a comfortable position. And now we will move on to our hand hygiene. So you will perform hand hygiene again. After that, you will now go to your sixth right, which is write documentation and assess all your findings on your MAR and assess the patient's tolerance to the drug. And again, if they had any allergic reactions. After that, the last thing you would do is return to the room to reassess the patient if indicated.